All right, and good afternoon, everyone. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Bair Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 2nd of December. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or directly via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Biskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
So in the United States, we are seeing about an average of 83,000 cases over the last 7 days. Yesterday in the United States, we saw yesterday in the United States, there were 108,000 new COVID cases. There is a 50-50 split in cases that are seeing, in states that are seeing increasing cases and decreasing cases, but our overall hospitalization rate has gone up 15%. In Illinois on December 1st, there were 6,165 new COVID cases with an average of about 4,200. What can you tell us about this 50-50 split that we're finding in COVID cases over the states?
Well, we're just observing, how the pandemic, how the virus moves across the country. And it's not homogeneous. It's not all happening at the same time in the same place. This pandemic, this wave of the pandemic really started in the southern states, and they were really hit very hard. And the northern states and some of the western states and Midwest, upper Midwest was pretty well controlled. And now the opposite has happened. So the southern states have gone down, and they're the highly populous states like Texas and Florida. And then the upper Midwest, Northeast, and some Western states that have skyrocketed. I mean, Michigan is like, the #1 state now. So, this is just how these things move around the country. And it's interesting now that it's really a 50-50 split in terms of the states going up or going down. Overall, though, it's going up. I mean, we're still having increases in the case, and what's happening is it's in the states that are having these big increases, it's stressing out the hospital systems there. There's not as much leeway in the hospital system as one might think to handle all these additional sick people. Remember, these COVID cases are just being added on to all the other diseases that exist out there, and that every year some 2.8 million people in the United States die of something. And then this is on top of that. And not only people dying, but ending up in the hospital, ending up in the ICU, ending up on a ventilator, and it's stressing out many of those medical systems.
Yeah, definitely. And now for our first COVID headline. Yesterday, we saw that the first confirmed US case of Omicron coronavirus was detected in California. So what can you tell us about this first case that we have found, and et cetera, how that's going to change?
Well, it's no surprise. Everyone was saying most likely it's in the United States all along, and that we just hadn't found it yet. And sure enough, we found it. It's in California. Fortunately for the person, a very mild case. A person who's vaccinated but did not receive a booster shot, and this person had traveled to South Africa. So this person did import the virus, most likely from South Africa. Fortunately, they're vaccinated, so they're having a mild case. That's good. But the person did not have a booster. Now, I don't know if they were eligible for a booster and just didn't get it, but it brings up the whole booster question because that is going to help, it looks like, with this variant. So that's good news. So in the United States, only 15% of eligible people have taken a booster. In Illinois, it's higher. I believe it's 37% have taken the booster in Illinois. So we're ahead in the booster game. But that's really what's needed at this particular point. Get vaccinated, get the booster if you're eligible. And that looks like it's gonna, is very likely to hold its own.
So with that follow-up, what can you tell us about this? They're tightening the restrictions for travelers with the new worries of the variant.
Yeah, we know travel restrictions don't work perfectly, and they stranded a lot of people, and that's unfortunate. But they will slow down the import of the virus into different places and allow health departments to track the new people that are infected, and trace them, isolate them, isolate their contacts. And when you're having just a few cases, you can do that. When you get into these tens of thousands, you can't do that. There's not enough. There's no way you can even do it. So it has a limited value in a limited period of time. And so that's good. There's a lot of unknowns right now with Omicron. It looks like it is transmitted easier. It's beating out Delta, most likely. So it's likely to take over at some particular point. The question is really just how fast this is going to happen. So we have to be vigilant. There's many things we don't know, though. We don't know if people get sicker if they're not vaccinated, or if there's more death with it. We're thinking that with the vaccinated, it looks like it's holding that right now. That's just very preliminary information. But we certainly don't know anything about the frequency of asymptomatic people with no symptomatics, if they can transmit it, and if there's a lot of them. We don't know the impact on long COVID. Is it twice or 3 times as high, or the same, or less? We don't know about the multi-system inflammatory condition that's reported in children, if that's going to happen. And we don't know overall the impact on younger people. Are they going to get sicker? Are they more likely to get infected? We don't really, those are unanswered questions. And hopefully we're going to have the answers to those questions, and then the big questions about how good do the vaccines really work with Omicron? How good does the antibodies, the monoclonal antibodies, work? There was a report from Eli Lilly, I think, and their product that looked like they think it does work. But it's all up in the air right now.
Yeah, and you just mentioned a lot of the topics that were going to be discussed in the third headline, but is there any other information that you think will come out in the next week or so with the variant?
Yeah, there's a couple of news items worthy. One is that there was one study looking at people with very severe COVID, very sick in the hospital or in the ICU and survived. It turns out in people less than 65 years of age who had severe COVID, have their death rate in the next year is twice as high as expected, related to their age and underlying condition. So COVID has damaged them to the point where other things are causing their death. So that's an unfortunate finding. The other is a very large study in the Veterans Administration medical system, the VA system, in 439,000 plus admissions to the hospital, and with COVID, and they looked at just the people that got the Moderna or the Pfizer vaccine. So the good news is that the overall rates of infection, hospitalization, ICU admission, and death are very low in the group in general, way lower than if they're not vaccinated. However, there is a difference between the two vaccines, and the breakthrough rate and the hospitalization rate are higher in the Pfizer group. So they both work. Looks like Moderna works a little better in preventing the breakthroughs and getting people hospitalized, maybe less with the Pfizer group. The mortality rate looks like it's about the same. But there is a slight difference in that. That doesn't mean the Pfizer one doesn't work. It works. They both work very good. So what happens is when the numbers get very low, the difference between them can be high. Like if you have a group of 5 kids and 2 of them get infected, it's 40%. You know, it's like sounds big, you know, but it's based on these numbers, and the numbers of people getting sick altogether are very low. So, but I thought that was an interesting and very large study. Now, there's a bunch of reasons for that. One, it's a different vaccine altogether. It has a different little envelope around it that may make a difference, and it is a different dose, so you're getting actually more virus. So we don't know which is the one that's driving that, but there is a slight difference.
Very interesting. Thank you, Dr. Murphy. Here are some questions. I was wondering if Dr. Murphy could talk about the recent headlines of the vaccine mandate for healthcare workers being blocked by a federal judge in 10 states. What implications does this have for controlling the pandemic? Are the mandates going to be left up to individual states?
This is very unfortunate in terms of the pandemic. We're not going to get our hands around this thing until we get over 90% of the people vaccinated. And for the judges to slow this down after two of these cases have made it to the Supreme Court, and the Supreme Court has not stopped the mandates. This is unfortunate. This just means that they're going to it has to play out in court more. May end up in front of the Supreme Court again, who knows? And are they going to allow the mandate to take place? It's not going to take place when they had wanted to do it, which is now, and then by early January. So that will be delayed, unfortunately. Very, very unfortunate timing for this to happen. But this politicalization is just very unfortunate in terms of public health. Because we know what works and what doesn't work, and the vaccines work. It's dramatic. So, and this involves some 80 million people. Now, many of those 80 million are vaccinated. So it's just the ones that haven't been vaccinated that this is going to impact. But it's very unfortunate.
Yeah, it is. And now for our second question. I've heard that scientists have identified 7 coronaviruses. When does a variant become a new virus?
This is a good scientific question. So the variants, so all these coronaviruses are all related. They all have things in common, but they behave very differently. There's 4 of them that typically cause just a mild cold, if they cause anything, sometimes asymptomatic, and people just ignored them because they're just like nothing happens hardly, blah, blah, blah. And then there was SARS. Now, SARS scared everybody. It was much harder to transmit than the common cold ones, but it killed 10% of the people. And then there was MERS, which was also hard to transmit in the Mideast. And that still exists, actually. And the mortality rate on that is like 30%. But those 2, SARS and MERS, are actually more difficult to transmit, which is great. And then SARS-CoV-2 comes up. Easy to transmit, low mortality rate, 1%, but it transmits like crazy. So if it kills 1% and everyone in the country gets it, that's 3.3 million people will die from it. And 3.3 million people dying from COVID is more than the death rate in 1 year in the United States, which is 2.8 million people typically die per year. So this is like on top of that. Now it's occurring over longer than 1 year. So it's not all happening in the same year. But that's to put the numbers into perspective here. Now, if the if this keeps mutating and changes dramatically, and there's it changes enough, it can be labeled like a new virus. But typically that is going to take a longer period of time, and mostly we're going to be dealing with this. We're going to be dealing just with variants.
Very interesting. And now for our third question. My 12-year-old was vaccinated as soon as it was approved for her age group. She will hit the 6-month mark from her second dose on December 4th. Is there any update on booster shots for 17 to 12-year-olds or 12 to 17-year-olds?
The booster shots are not approved for that age group as of this time. Pfizer did recently amend their emergency use authorization to give it to the 16 and 17-year-olds because they have had originally approval down to 16. So that was just applied for recently. And so I think it's a matter of time before this group, before they get enough data to show if they need it. Remember, kids, the younger they are, the better they respond. And so, they might not need a 6-month booster. Maybe it's a 1-year booster, who knows? But that should be forthcoming. And, they got the vaccine a lot later, so they're just coming up on the 6 months. So it remains to be seen.
Wonderful. For our fourth COVID question, this family is trying to decide if they can celebrate safely for the holidays. Their entire family is vaccinated and some have received their booster shots. However, many of them work in the public setting. Some of them are mandated to wear masks, others are not, and a couple of the family members are immunocompromised. What can they do to limit, their exposure and keep everyone safe for the holidays?
Well, this is a real common question and a very common situation. I think it's safe for vaccinated people to get together for the holidays. Everybody's vaccinated. Now you've got some caveats in here. Some of them work in the public and where people are not wearing masks or whatever. A few of the family members have health compromising conditions, but remember, they're vaccinated. So, they're still going to get some protection from the vaccine. So I think they can celebrate together. I think I would do two things though. One is anybody who does not feel 100% should not come in, not be part of the group. If they've got a cold, sniffle, sore throat, even a minor respiratory thing, forget it. They're out. They can go get tested and see what they have. But there's a lot of flu going around now too, or respiratory syncytial virus and other things out there. So they need to get checked out and they should not be in a group, all right, until they're diagnosed appropriately. The other thing that you can do is you can have everybody do a rapid test in the morning that everyone is getting together. They're over the counter now. They're talking about, insurance paying for them, or maybe the government's going to subsidize some of them. Many companies are giving them out for free to their employees if they want them. There's a way to get it done. And, maybe that would give you a little added confidence that it's safe to get together. Particularly with the people that have underlying diseases that are in the group. But I think in general, it's safe for vaccinated families to get together.
And for our last COVID question, this person has a question about vaccinated and unvaccinated within the high school system. Is it safe to consider high schools that are now open in person, where there are vaccinated and unvaccinated children that are mixing in classrooms every single day? What can you call safe and unsafe here in terms of mask wearing and such?
Well, it's really higher risk if the vaccinated and unvaccinated are mingling, especially in a school situation where they're playing sports, they're doing activities together and being in classrooms. A lot of things come into play. How crowded are the classrooms? How good is the ventilation? All this is, is it a safe building in that respect? However, these kids can be vaccinated now, and they should be vaccinated. And some of the states are mandating that students be vaccinated. And so I know the state of California is mandating that all students going into the LA Unified School District in the fall of 2022 have to be vaccinated. So I think you're going to see that around the country in certain areas and states where they actually believe in science and want to prevent this disease from continuing to spread. And I think you'll see more of that. And so then the risk would be much lower.
Yeah, definitely. And now those are all of our COVID questions for today. Thank you, Dr. Murphy.
Okay, thank you. Have a great day.